Okay, what causes low back pain? Low back pain is either going to be caused by joint pressure, disc pressure, or nerve pressure. What I'm holding here is a model of two vertebrae from the lower back. This would be called the body of the vertebrae, okay? In between it is a cushion called the disc. If we look at the top of the vertebrae, the body itself is large and round. Behind it is the opening called the spinal canal where the spinal cord goes down inside. It then sends the nerves out between an opening right behind the body. Then if we turn the vertebrae, we can see the joint that is right here and also over here. You have a right and left. The cord is going down the spine, sending the nerves to the side. Okay? On each side here of each vertebrae is little protrusions called transverse process. This is where muscles and tendons attach that move the vertebrae. As we turn the vertebrae this way again, we look at the back side of the vertebrae, which is called the spinous processes. These are held together with ligaments. You actually can feel these bones when you touch them from the outside, from your back. Now, to show you adverse joint pressure, you would look at this joint and see that these are movable. So if the vertebrae is assuming an adverse position to where that joint is jamming, let's say down like so, and creating joint pressure, you're going to get inflammation. At the same time, when a vertebrae slips out of its position, creating joint pressure, it can also create pressure on the disc to where the disc will actually protrude, bulge, or actually herniate. The disc itself is made up of three types of material. One of the materials is like a cartilage. Inside that cartilage is many fibers like a steel belt tire. And then inside the middle of the disc is a substance that's like jelly that actually is called the nucleus. When the fibers break down in the disc will shift and bulge. In doing so, they in turn can create pressure on what we're calling the nerve here, where it passes from the cord. Just as this model is showing the disc pressing against the nerve. So there you would get adverse nerve pressure. You can also get adverse nerve pressure by the vertebrae being out of position to where it actually crowds the opening where the nerve comes out. Just as I'm demonstrating here, okay, by closing down here, the opening right in here is closed some. So all of these, by the shifting of the spine or injuries to these tissues, will cause adverse joint pressure, adverse disc pressure with bulging, and adverse nerve pressure. So that's what causes low back pain.